Okay, hi, good morning. Today I'll be talking about how to diagnose autism. My name is Deshane Gutierrez. I am a clinical psychologist and I am the owner of counseling and psychological services. So before I talk about how to diagnose autism, I want to explain what is autism. Right? So I'll be explaining what is autism. So our objectives for today is to talk about understanding the characteristics of autism disorder, identify some observable behaviors that you'll notice in a person with autism. We'll also talk about what are some disorders that have similar characteristics of autism. There are a lot of times people talk about autism and they think their child is autistic, but there are other possible diagnoses that a child could have that are challenges. So I want to talk about what are the similarities and what are the differences. And then I'll be talking about what is a test profile and what test is used to give a proper diagnosis of that autism and treatment planning. So these are the things that we will be covering today. So what is autism? Autism is a neurological disorder. It's an umbrella term for persons that has a range of challenges with social communication, social interaction, and repetitive behavior. So that is, in a broad sense, what autism spectrum disorder really is. For a person to be diagnosed with autism, they have to meet at least two main criteria. If they don't meet these criteria, then they're not diagnosed with autism disorder. So one of the main things that a person must have, they must have persistent deficit in social communication, and that could range from a wide range of things. So for example, they're having difficulty engaging in one-to-one conversations, having difficulty interpreting body languages, their nonverbal cues. They're also having difficulty starting a relationship or maintaining a relationship. Why? Because they're having difficulty understanding the language of communication. So that is one of the major criteria that a person must have. Another major one is repetitive restrictive behavior pattern of interest. And this can range from a wide range of things. It could be like speech, a song. So for example, a child may be repeating one word consistently or a phrase. Or when you're talking to that child, the child may repeat the phrase over and over, not in the same context that it's supposed to be. They may also have, or you may notice, repetitive motor behaviors. So they may notice some upward motor behaviors. Some child may engage in hand flapping. Some child may be running up and down the same pattern. For example, if you're at home, the child is consistently running from the hallway over and over, consistently non-stop. They also have difficulty with routine. They have a very rigid, and sometimes they're not always rigid. And I always want to say that because sometimes we think that because the diagnosis says they have rigid behavior, it means that anything that someone likes to do, a person is autistic. But what happens is a person who is autistic oftentimes have pattern that they are used to that makes it comfortable, and so they need that routine. They are inflexible in their decision making, and it could be either verbal and non-verbal. They have high fixation. They enjoy something to the max. So for example, if a person like shark, for example, they want to know everything about shark. They talk about shark a lot. You're having a conversation about how the day is going, or you're talking to them about something that you see on TV, but all they want to do is talk about sharks. They will only engage in conversation that is of interest to them about the topic or the toy or something that they're fascinated with that will have interest. So again, it goes back to criteria A that talks about the difficulty with engaging in conversation. Is that it's not that they can't have conversation, but oftentimes when they do have conversation, they prefer to talk about something that they do like. Now again, this is just the basic rundown of what autism is. It's a spectrum, like I said in the beginning. So because it's a spectrum, it means then that there will be some persons that are not as rigid as other children. And I think that is very important that we talk about the spectrum, because then oftentimes we expect to see all these things straight down for a child to be diagnosed with autism. Some children are also more sensitive to sensory input. So sensory input could be any of the seven sensory reception. It could be visual, it could be hearing, it could be so it's visual, hearing. There's also in terms of motor, taste, touch. So all of these things, a child may be very sensitive to it. That means that for their sensitivity to sound and noise may be louder or stronger compared to other children, and it could be hypo, whereby they need more stimulation for them to have a response, right? And this usually happens from early development. So from the time a child is about 6 months, parents oftentimes start to notice changes. A child can be diagnosed for as young as 18 months for autism spectrum disorder. So they will already start to see some characteristics. Some parents may notice that they have difficulty engaging with their child. So normally when a baby is young, the engagement is there. You talk to the baby, you do baby faces, and the baby is able to respond. For persons who have autism, there's usually a history of that there is some delay. So they may have it, some may have it, and some don't. And so that is where the parents start to say, you know what, I'm noticing that something is different about my child. And then they continue to monitor it. For a diagnosis of autism, it must not be better explained by intellectual disability and global developmental delay. Why is this important? Because oftentimes some of the same behavior that you may observe when a child is developing between the age of 1.5 is also similar to a person who have intellectual disability. Intellectual disability is when a person when their cognitive ability is not sufficient enough that they're unable to understand the world around them. And global delay is similar, but it's for a person under the age of 5 years old. So for example, between the ages of 1 to 5, a person will be diagnosed with global developmental delay. And usually after the age of 5, then they'll be diagnosed with intellectual disability. So they're related, but the time frame is different. Global developmental delays for children under the ages of 5 years old. And they oftentimes have numerous challenges for development. It could be speech, it could be language, it could be in terms of engagement. So global delay in terms of for everything, they're not meeting their milestones. They're not meeting developmental milestone that is important for a child to be able to reach. And then after the age of 5, then they're oftentimes diagnosed with intellectual disability. And there's different levels. Some persons who are autistic, they do not require so much support, and so we'll give them level 1. So they need minimal support, while some person that may be at level 2 may need more than minimal support. They need someone that will help them in terms of how to respond, how to engage. And then for level 3, they need a lot of support. So they may need to work with an ABA therapist, they need to work with a speech therapist, they may need to work with an occupational therapist. So there are different aspects that they need assistance in different areas. So depending on what the diagnosis is, then they'll determine what level and how much support that child really needs. A person with autism could also be diagnosed with or without intellectual impairment. So in terms of they may have difficulty with understanding some level of comprehension. They may have difficulty with language impairment, and it could also be associated with a medical or genetic component, and it could also have level of catatonia. Catatonia is the rigid movement in body. So remember I talked about earlier for repetitive behavior that sometimes a person may have rigid movement. So that is, they may put themselves in awkward body positions at times. So we also try to specify this. These are specified so that in terms of recommendations for treatment, these are things that the other professionals working with the child will be able to help provide support for, right? So I just have a visual in terms of what are the characteristics of autism spectrum disorder. So like I said, it's a combination of social interaction impairment, communication impairment, and repetitive behavior patterns and interests. And that could range from a different range of things. So what are some red flags for social interaction? So sometimes you'll notice some of these things. For social interaction, some of the red flags that you will see is that a child may show limited interest in interaction. They may respond inconsistently to social bids. So it's hard to get to them at times. It's hard to engage them in conversations. So why did I put this here? I put this here because oftentimes we think that person with autism have no type of communication, no type of social interaction, but they do. Just that at times it may be limited and it may not be as consistent. So consistency is part of the key. It's not always that they don't have these skills. It's that if they do have it, it takes a lot of effort on them, and oftentimes parents have to encourage them a lot for us to be able to see the behavior occurring, right? With peer relationship, like I said before, they may have limited interest in their same peers. They may prefer to play alone. If they have something that they're interested in, that is the thing that you'll notice that they'll be doing over and over more often, right? They may show a limited range of facial expression. They may respond inconsistently to other person's emotions. So sometimes people will describe them as they are hard to connect with because they are emotionless, or they may show too much emotion, and that makes it difficult for them, right? Play, when they're engaging in play, they may not use toys how the toys is created to be played. They'll oftentimes look at it very closely. They'll play with it in a strange, atypical way compared to what typical child would engage in. So they have limited functional or imaginative play. And whenever I hear about this, I often wonder in terms of, we call them limited because it's not how a typical child will engage in. But sometimes when you're observing a child and they're interacting, we may not always get it, but they are engaging in play. They are engaging in what is their world like. So I think it's very important to know that while they play, their play is not as what we would expect a child to engage in, it doesn't mean that they can't engage in play. Right? So our role is to try to understand how they play so that we could be a part of their world. And that may take some time at times. It may not always be easy to get into their world. And so one of the key things is to observe them a lot so that you can know in terms of how to be a part of as much as possible. For communication, some of the red flags there in terms of communicating and questioning, is my child autistic, or are they characteristics features in terms of they may have limited gestures in communication. So similar to social interaction, it's also a communication aspect, right? In terms of requesting, so when we're assessing them, we often look in terms of how does this child request? How does this child gain attention? How does this child engage others? So these are some of the areas that we look for when we're doing assessment, right? Do they really rarely communicate to share interests? So like I had mentioned before, if the person loves sharks, for example, while they're engaging with that shark, they may not want you to be a part of it. But they may be at times where they want to share and talk to you about what shark really is, the history of sharks, the habitat of the shark's life and stuff like that. But anything else, so if you want to have a conversation about something that you like, they may not be as interested, or they may listen for a short while and then they change and go back to talking about sharks, right? In terms of requesting, how do they request? Do they give you eye contact? Is it that they point to what they want? Do they say what they want? How do they engage to let a person know that they want something, right? And again, how do they have functional play as well? So what are some of the behaviors that is also alarming? So like I had mentioned before, their use of toys or other objects may not be typical to what we would expect them. Some of them engage in spinning them, lining up their toys, building blocks. So for example, a lot of times they enjoy building blocks. They just put all the blocks on top of each other. they may engage in unusual behavior. So again, these are similar to what I have described in one of the characteristics. I just put them more in detail so that you could have a sense in terms of what are some of the things that are red flags in terms of behavior. So now I want to get into the gist of our conversation. And so for some children, now oftentimes it's more easier to observe these things in boys. Girls tend to mask it a lot more. And so if within their first couple of years of life, the pediatrician or the mom didn't notice it, or the family didn't notice it, sometimes that's when they reach at school that then teachers start to observe that the child may have difficulty paying attention, may have difficulty transitioning from one class or one subject to the other, have difficulty interacting. The child may be in the classroom but there's no social engagement. The child may have frequent meltdown. Now, I want to talk about what meltdown is before I continue. So meltdown is when a child have an emotional overload and they are unable, despite the change, to calm themselves down. So for example, if a child wanted the red crayon, but one of the classmates is using the red crayon, even if the classmate give the child that red crayon, it will still take a while for that child to calm down. Because it's the crayon, receiving the crayon is not just the aim. It's because the child has an emotional overload that it's difficult for him or her to calm him or herself down after receiving the thing that they wanted initially, which is different from a temper tantrum. A temper tantrum, if the child wanted the red crayon and he or she didn't get it, they'll cry, they'll fuss, but the minute you give them the red crayon, they'll stop. So that is the difference between a meltdown and a tantrum, and that is very important. So at school, the teacher will notice meltdowns rather than tantrums. They'll also have difficulty with expressing language. Again, because a part of the criteria is they have difficulty with social communication and social interaction. They may have poor academics in some areas, but they may also excel in other areas, and that is also important. So not because a child is autistic means that they can't function in the classroom, and it means that they can't learn. They will have different areas where they excel and different areas where they struggle with, which pretty much everyone has difficulty with, right? And so I want to stress that because oftentimes I hear parents say, well, the school said that my child doesn't belong in the classroom because they're unable to cater to their child's needs. And so that's one of the reasons why I believe that testing is very important, because a child is more than their diagnosis. It's not just, okay, the child is autistic, but an assessment can give a lot more than just a terminology that describes the child. It talks about who the child is in different areas. So the testing profile, no two child who is on the spectrum are alike. So you could have two children that is autistic and you'll see different things on both of them. So no two child is alike. So it's also important when you're doing an assessment, the aim is to understand what is the child's deficits and strengths, and which is oftentimes gathered in the clinical interview. So the clinical interview is with the parent or the guardian, and so that is at our first meet. The parent gave us much information from the time they were pregnant until the time the child is being tested, so that we get as much detailed background information as possible. And that this is very crucial to the diagnosis. Apart from the standardized test, it's also very important that we get as much information as possible. There have been times whereby parents have come, and because they read a lot, they give me textbooks information. And so oftentimes I'll tell parents, take your time, or let's wait a week or two. Don't read anything on the internet and just tell me what you're observing your child is experiencing. Why is this important? It's important because, like I said, there are different diagnoses that a child could be diagnosed with other than autism. But oftentimes, because they start to observe deficits or challenges, everybody goes to autism. And so it's very important that you observe your child. Know what are some of your child triggers, or what are the challenges that you're having, so you can explain that to the person who is administering the test. So like I said, for diagnosing a child, there's a lot of things apart from just reaching to a diagnosis. We also have to exclude other disorders that are similar to autism or have similar features of autism. So I created this table here because these are the four main diagnoses that have similar characteristics to autism spectrum disorder. And that is, so remember, for a child to be diagnosed with autism spectrum disorder, they must have difficulty with social communication and repetitive behavior. And then we'll talk about their overall development. So intellectual disabilities also you may also notice that a child may be exhibiting behavior similar to that of a person who is diagnosed with autism. So in autism, for social communication, you'll notice that the child will have impairment in verbal and nonverbal, or just either one of them, compared to the overall development. While a person who has intellectual disability, their challenge with social communication is consistent with their developmental level. So remember, I had said that intellectual disability is when a person has difficulty in understanding the social pragmatics, their environment, and so their cognitive ability is very limited. So a person with intellectual disability will also have social communication difficulties, but it match their developmental level, right? Similarly, for social communication disorder, there are also impairment with verbal and nonverbal behavior compared to their overall development, and also language disorder. Person who are diagnosed with language disorder also has difficulty with social communication. So if you notice, when a child has social communication challenges, it does not automatically mean the child is autistic. There are other diagnoses that a child could possibly have. So what are some of the key differences that we look for when we're assessing a child? So one of it is repetitive behavior. So for a person to be diagnosed with autism, they must have that repetitive behavior component, whether in history or currently, right? And there's a clear pattern of restricted interest and or behavior. So whether it's the interest in the sharks, or whether in terms of behavior they need a specific routine to be consistently, or it's the specific food that they need to eat, or it's a specific toy and the way that they engage with this toy over and over, or is it the repetitive movement or songs, right? For a person with intellectual disability, there is no significant pattern of restricted interest or behavior any at all. And similarly to for social communication disorder, there is no significant pattern either. And as well for language disorder. So repetitive behavior is one of the keys. So while social communication challenges have different diagnoses that are similar, one of the key differential diagnoses is based on repetitive behavior, whether that child may or may not have it, right? For a person with intellectual disability, there may be some type of repetitiveness may be present, but it won't be as pervasive or as consistent as a person who is autistic. For a person who is autistic, their overall development is uneven. So that means they have strengths and weaknesses all over, while a person with intellectual disability, in every area, it's a weakness for them. So their pattern of development is consistent. Similarly, for social communication disorder, there is also an uneven pattern of development. And for a person with language disorder, there's an overall speech developmental delay. Right? So this is why it's very important that, apart from getting a diagnosis, because a medical doctor can give you a diagnosis of autism, but that's all you get, a diagnosis of autism, but it doesn't differentiate all of these things, and it doesn't give you about the strengths and the weaknesses of your child. So what does a test battery include for when you're assessing someone with autism? So like I mentioned, the developmental history, the child medical history, and educational history is very important, right? And we get this information from the parent, the caregiver, teachers, and review of records. So if a child is under the age of 5 and not enrolled in the classroom setting as that, we rely heavily on the information from the parent. And the parent recall is very important, right? Their language development is also assessed, This is assessed both by observation and standardized assessment. Now, all of the assessments used in Belize are currently standardized tests that are based on the US, because we don't have any locally standardized assessments. So the assessments used are based on the US, right? So we use standardized tests. And there's different tests that assess for language assessment, expressive and receptive. So expressive is how the child is able to express themselves, and receptive is how the child understands what is being spoken to him and her. Another area that is assessed when you're doing a full psychological assessment is the social communication and interactions. So again, we look for a pragmatic language assessment. Pragmatic language assessment is, simply put, understanding when someone is talking to them and understand what that means. There's also informal assessments, so we may engage in child play. So for example, for children under the age of 2 years old, we often use the STAT, which is a screener in terms of it looks for how the child requests information, how the child demands stuff, how the child interacts, and how he or she shares their world. And so we use different toys to have them engage and illustrate these things. We also again have parents fill out forms in terms of what they're observing at home, because it's important to not only base information on what we're seeing in our office, but it's also important that we get the information from what the parents is seeing. And if there's other person in the child life, so for example a babysitter that the child spends a lot of time with, we also want them to give us information in terms of what they are seeing. The cognitive component. The cognitive component is very important because we want to understand what is that child's strengths and weaknesses. Like I said, a child is more than his or her diagnosis of autism. Autism just describes a part of who the child is, but we also want to know what is this child's strengths, because that will help us in terms of making recommendations, in terms of treatment planning. And the next step forward after the diagnosis is, okay, how do we stimulate this child? What does this child need? Is this child more verbal? Is this child non-verbal? And even if the child is verbal, okay, what is the strength of this child and what is the weaknesses? So that information, as if it's at school, they are able to adapt the curriculum to meet the child's needs, right? And it also gives us a realistic expectation in terms of what can this child really do. So that is why we do the cognitive test. Adaptive skill is also important. The adaptive skill focuses in terms of how does this child adapt in its environment? How does this child request? How does this child take care of him or herself? When the child is in distress, emotionally distressed, how does this child function? It's important because then we want to be able to have the child to be able to function in his or her environment. And so we need to know what is the child baseline, so that whenever the child is receiving other treatment or other services, then they'll use that to as a benchmark then to create, okay, is this child moving from point A to point B? And if so, what are the challenges and what are the challenges and what are the strengths of it? The academic performance. Academic achievement is also assessed if the child is already in the school setting. So we want to be able to know where is this child for reading, for math, and for comprehension? Why is this important? Again, we live in a world of academics, so we want to know if they'll be able to excel within the school function, if they have reading disabilities, or not only the challenges, but what about the strengths? So we want to also focus in terms of, is this child really good in reading? Is this child really good in maths? And then so we build on that. So that is why we do a comprehensive assessment that focuses on all these areas, because we don't want to just know that the child has a diagnosis of autism, because that is only a piece of it. We want to know, who is this child? What is this child's strengths and what is this child's weaknesses, and how can we help to accommodate this child based on what the child needs? So this is what a typical autism battery will look like. Now, parents oftentimes have the option if they want to just know the diagnosis, or they want to have a a shell in terms of what is their child's strengths and weaknesses. Now, some of these things parents could tell you depending on how old the child. Some parents can say, Miss, this is my child's strengths and this is my child weaknesses. But sometimes they need something more formal or more in depth so that the child could get other services that they need. Now, one of the challenges here in Belize is in terms of treatment. Now, after you get the diagnosis, after you doing testing, where do you go to? And so we do have some professionals in country that are able to use the assessment now to help to create their own treatment plan. They may also use their own personal assessment, but this will be a more comprehensive assessment that they can use. So, for example, if they're going to work on behavioral challenges, they need to still know what is this child cognitive strengths and weaknesses, because based on the child cognition or based on the child level of intelligence, then they'll know in terms of how basic or how much more information they'll need and how to adapt their strategies that they'll be implementing with the child and the family. So this is pretty much a breakdown of what a battery will look like. And sometimes in some testing behavior that we'll oftentimes see, depending on the child, they may have some level of inattention, hyperactivity. We may notice some repetitive behavior. Is it a song? Is it the noise that they make in the class, in the office? And sometimes it may be difficult to build a rapport or a relationship with the child. Sometimes it's easy. So again, it all depends. One of the things that I often look for when I'm doing the cognitive test, for example, is I look at their verbal comprehension. Because remember, I had said that their comprehension level is very important. So I look at that, and I also look at their reasoning skill. Is their reasoning fluid? That means, are they flexible in their thinking, or do they have a more rigid thinking pattern? So those are little things that I look for on the test. In terms of to give me an idea, apart from what the parents is saying or apart from what I'm seeing in the office, I also look for these on the test scores to match, right? Because we want information that is consistent. We don't want so many fluctuation of inconsistency, because we want to create a profile in terms of who this child really is. So these are just some of the things that I look for during testing. So now that I've talked in terms of how a child is diagnosed, so if you notice, a child is diagnosed not just by just interviewing the parent, even though that you can get a diagnosis like that, is also okay. But you also want to get a detailed assessment of your child, so that way you get the full picture. And so that is why this is important. I think this is the most important part. You want to understand each area. And so whichever professional is working with the child, they use this to understand holistically what are this child's strengths and weaknesses in their language, in their communication, in their interaction, in their behavior, in their intellectual abilities, in their ability to adapt, because this is very important to create a holistic plan moving forward. So I am not the person that oftentimes work with them after the assessment. I just conduct the assessment, right? But this is pretty much a standard of what an assessment is like. And I use all the latest assessments because I believe staying up to date as much as possible. So even though these tests are normed in the US, I also use it in the Belize context in terms of what is our norm locally as well when making a diagnosis. So now that I've explained, I will open it up to you guys now. If there's any question, please feel free to ask any questions. So anyone online have any questions that you guys want me to answer in terms of testing and diagnosing someone with autism? Okay, so someone asked if I have any recommendation on who we should contact after this comprehensive assessment. So based on in terms of what the result is saying, some of the most typical common recommendation would be, for example, will they see an ABA therapist. So an ABA therapist is an applied behavior analysis therapist, and what they does is they analyze the child's behavior, what is the function, and understand um, in, how to adapt the behavior into a behavior that you want to see. So, for example, if a child does head banging, then an ABA therapist will investigate and learn what is the purpose of the child head banging, and then teach a child strategies in terms of, rather than doing head banging, they can do something else. So an ABA therapist, we do have an ABA therapist in Belize. So I would make a recommendation, referral to Miss Cindy Rosado at Belize Medical Associates. Or if it's a speech or a language component, then they make a referral to a speech language pathologist. If it's something to do with motor abilities, then an occupational therapist or physical therapist. If it's something with academics, for example, I try to see if we could reach a special ed teacher to help to make adaptations. The challenge is we don't have as much as other countries, but we do have. And so one of the key things is for those that we do have in Belize is to work together so that we at least have a starting point, right? So ABA therapy is one of the things that I oftentimes recommend. How long does an assessment last? So depending on the age of the child, an assessment could last half day to an entire day. Now again, because of the stress level of the child, we may not do an assessment in one sitting. We may have to do it in smaller parts because, one, I don't want the child to be frustrated and flustered, so I go based on the pace of the child. But oftentimes we'll often make an appointment for in the morning, and then based on how the child is behaving, we determine how many days that will be. But more likely it's a day or 2 days. Okay. Someone says that they teach in public school and they want to know what are some of the signs to help us figure out if a child in our class is autistic. So like I had described earlier in the beginning, there are two different areas that we focus on: social communication difficulties and repetitive behavior. So social communication difficulties could be anywhere from the child is having difficulty engaging, meeting friends, engaging or keeping friends. They may also have difficulty in understanding what it is that you're instructing them to do. Or if they do understand in terms of that one-on-one, giving eye contact, engagement, responding to what it is that you want or have an interest, that may be a difficulty. In terms of what you may see, they may have difficulty following instructions. Some may follow instruction to a T. So like I said, it's a spectrum. So whenever you're noticing concerns, it's always best to talk to the parent in terms of, this is what I'm seeing in my classroom. And then the parent oftentimes would say, okay, well, this is how my child behaved typically, or is something that they didn't notice for themselves. But one of the main things that you'll see in the classroom is they may have difficulty understanding what you're asking. Or, for example, they may follow everything that you say, and the minute that you change something that you said, they are unable to take it, or they get frustrated because you already gave them something to look forward to, or you already teach them one way, and so whenever you divert, it becomes difficult for them. So again, one of the things, when there's a transition from a subject or a transition from an activity, they may have difficulty with that transition. I also want to note that sometimes people like to say, well, the child speaks well, so the child is autistic. A child doesn't always have to speak well for a child to be autistic or Asperger's. That is not one of the hallmark of it, and that's why it's always important to get a child assessed in all different areas, because a child could speak well, but it does not mean autism as well. So someone has here, is there a need to do updated assessment after the initial one, and how often should we get our children assessed? So yes, it's very important for a child to be assessed. After the initial one, it's usually recommended a year and a half. Why? Because it's hoped that based on the recommendations given, then we want to be able to assess what progress has been made. So an assessment is only a shell, a description of the child's strengths and weaknesses for that time. And so after the recommendation, it's hoped that we see some level of growth or change. And so we want to be able to monitor that. So the life of an assessment is very short. It's about a year and a half, depending in terms of what are some of the recommendations. So you may not always need to do a full, complete, comprehensive one all the time. You may do smaller assessments to measure in terms of what are the recommendations, right? Some things that tend to change at time is, for example, we always want to assess in terms of the cognition, if they're flexible or not flexible, and based on the strategies, if there's a change in that, and then having parents and teachers complete forms. So a year and a half after every year and a half after initial assessment, you want to be able to reassess. A person cannot outgrow a diagnosis of autism spectrum disorder. Autism spectrum disorder is a neurological disorder, and so that means it's how the brain processes information. So you don't outgrow. What happens is you learn how to survive in a typical world. So the same way how we want them to adjust to us, we also have to learn how to adjust to them. And so persons who are able to better function in society are persons who, one, are able to be themselves, but also learn strategies how to function within a typical society that oftentimes doesn't always consider them. And so it's not a matter of outgrowing, it's about them learning how to process and to express what is it that they're experiencing. But it's also teaching us persons who are not autistic to learn about autism, so that way we're more cognizant, we're more aware, and we are not also rigid in our thinking or expectations as well. So a diagnosis of autism is a way of life. It's who the person is. So it's not something that they outgrow. And so oftentimes I don't always call it a disorder. It's just a neurotypical way of processing and viewing the world. Is there any more questions? So a person says, a child who knows all their work does excellently but refuses to speak in the class. I've heard her speak maybe once or twice per month. Is this autism or something else? It does not always automatically mean autism. There may be other reasons why the child doesn't want to speak. It could be anxiety, for example. So speaking to the parent in terms of what you're noticing in class and having the parents give you feedback will be beneficial, right? Because that way, not speaking, if the child can speak, is it a matter of choice? Is it a matter if the child is having difficulty making friends, or is the person shy? So autism, it may not be autism. It could be, but then that information is too limited to suggest autism. Okay, I didn't hear the question. Let me just go back. Okay. Someone asked if I answered the question, but I can't see the question. Okay. Is there any more questions? I believe I have answered all the questions so far. Okay. So how can you get in contact with me? So my cell number is 636-0823. My office is located at Buttonwood Bay Medical Center. And you can check out my Facebook page at Counseling and Psychological Services. Camille asks, is there any sign that the child might talk? I think she was responding to someone else, the person who said that the child in the classroom only speaks once or twice. So because the person stated that she has heard the person talk probably once or twice, it does suggest that the person is able to speak. But like I said, we'll need more information to be able to give a response more clearly. Okay, so the person does speak to her parent. So again, we have to wonder if it's anxiety, because there's also an emotional aspect to it, right? Is it long? If it well, from what you're saying, she speaks to her parents and there's a communication. Then we have to be able to assess what is the classroom setting like for that particular child, and apart from speaking, is there any other concern? Because if speaking is the main concern, then probably an assessment with a speech language pathologist or even working with just a counselor to assess in terms of what's happening. But it seems to be overwhelming for her to speak in class. She observes classmates but doesn't say anything to them. Again, so it does sound like there's some emotional component. So suggesting the parent that the child may seek a professional assessment could be something that you can do. So a person says that I have a 5-year-old that says maybe 4 words the most. Is that a sign that he will be able to speak? So the fact that the child is only speaking 4 words is already showing a significant delay in speech development. There's a difference between speech delay and language delay. So I want to ask you, does this child have difficulty understanding when you're giving instructions? Apart from speech, is there any other concern, Camille? So, because the child is 5 years old and only speaking 4 words the most, it's already indicating that the child has a speech delay. Is there anything else that you're concerned about? So an assessment will be good to be able to determine in terms of why is it that your child is having difficulty in articulating words. You also want to be able to have your child do a hearing test to see if that is also a concern. Now, why a hearing test? Because you may say, well, my child could turn around when he or she hears a noise, but there's different pitches and sounds that could be impacting in terms of learning how to speak. Okay. So Camille, so based on your response, you said that he doesn't. He does as we say. Well, that's once he wants to. So that is already indicating that there's some level of language proficiency that he has. So that is saying, well, he can understand, but it's a choice. So it's telling us that he doesn't have a communication delay, but he has a speech, and so he may need to be assessed by a speech pathologist. So remember I had said in the beginning that there are other diagnoses that a child could get apart from autism. They could be intellectual disability, it could be social communication disorder, and it could also be a language disorder. So a child will need to be assessed so that we can know definitively in terms of is it this or is it that. An assessment will be one of the best options because you know for sure where your child really is. If it's primarily only speech, then you just need to be assessed by a speech pathologist. One of the things that I think is very important is that typically we're not a country that we make note in terms of our child development. We don't take track if the child is meeting his or her development. We don't know what are the developmental criteria in terms of how do we know if our child is meeting their development. So I think one of the things is as parents is to start to jot down things that you notice or what are you concerned about, so that way whenever you go to the professional they're able to use that information. Because like I said in the beginning, the interview with the parent and the caregiver is very crucial in our diagnosis. If we have inconclusive information or we have information that is very limited, we're unable to make conclusive diagnosis because the background information is very important. Okay. So I'm not sure that anyone in Belize does the hearing testing here. Most of the persons that I know typically go to check them out. I was told that there's a speech language pathologist that comes 1 or 2 a year from Chicago. She's a Belizean American, and I know she does hearing testing, but I'll have to get back in terms of what is her contact information so I could give you to know when she's coming back into the country. I don't know anyone else, but I know that persons usually tell me that they go to check them out to get an assessment. Okay, so you said that he's diagnosed with moderate autism, so I'm assuming that means level 2 um, diagnosis. So in terms of support, he needs um, more support. So someone says, good morning, I have a 6-year-old son that doesn't speak unless he's upset. He would say mama, dada, and once even said outside. He does what we tell him to do, but his main issue is he only listens to myself and his father, otherwise he throws tantrums. Only at his school, Stella Maris, he pays attention half of the time. Does this mean that he has behavioral issues? From what you're saying, it's hard to say it's completely just behavioral issues. So again, what will be needed is to do parent-child assessment, because we want to understand why is it that he listens to his parents but he doesn't listen to outside. What are the messages or mixed messages that he's interpreting? Apart, so you said he doesn't speak as much, so probably seeing a speech pathologist would help. But I could also do assessment in terms of his expressive and his receptive language development. So I could do those assessments as well. If it means that behavioral issues in children oftentimes signal that parenting style and mixed messages may be something that makes it difficult for that child to be able to maneuver. So behavioral issues oftentimes depicts that there's a family dynamics going on, and so again, that needs to be discussed on a one-to-one. So it's hard to just, based on what you said, to automatically say it's behavioral issues. It's signaling that there is a concern there. And so an assessment, it doesn't always have to be a comprehensive assessment, but assessment with the parent-child dynamics and getting background information is very crucial. Yes, you can send me a private message. So you mentioned throw tantrum. So like I had said in the beginning, tantrum is different from a meltdown. Tantrum means that when the child doesn't get what he or she wants, the child cries, throws a fit, but the minute the child gets what he or she wants, the child stops. So that is already telling us, one, that the child understands what is happening, and the child is doing it to manipulate, to gain what they want. When a child has a meltdown, even when the child is given what they wanted initially, the child doesn't stop immediately, because it takes a while for him or her to calm down, because they have an emotional overload. So if the child is doing tantrums instead of meltdown, it is indicating that there's a behavioral concern, and behavioral concern is signaling that there's something in the environment that is happening, or the child learned that behavior and was rewarded, and so tantrum becomes a means of communication. Is communication and behavior is telling us something. Sometimes it's difficult for us to understand what it is, and so that's why it's important to track and to see when this behavior is happening and what is the response, and how does the child maneuver or manage his or her emotions, because those are very important for diagnostic purposes, and it's also important in terms of treatment planning. So is there any more questions? Okay, that seems to be all the questions. Well, I want to thank you guys for tuning in. Remember, the purpose of an assessment is more than a diagnosis. It's about understanding the profile of a child. Remember, no two child is alike that is diagnosed with autism, and it's very important that we understand not only if the child is autistic or not, but also if the child is not autistic, what diagnosis does the child meet? If the child doesn't meet a diagnosis, it's also important to understanding the different areas of a child. We want to know their adaptive skills, we want to know their social skills, we want to know their intellectual abilities, because all of these will help us to understand how does this child function within his or her world, and it also gives us information in terms of how do we make recommendations to assist that child. Since there are no more questions, I just want to say thank you guys for tuning in. It was a pleasure speaking and talking about diagnosing autism. Today is World Autism Day. It's always good to learn the information, because if we support each and every single person, if we include our children who are autistic, then they also have a higher chance of experiencing depression and anxiety, because one, they get ostracized, they get pushed aside, and they oftentimes, while we may say, well, they don't like playing with people, or they don't like to engage, it's not that they don't like people, and it's about they're in their world at times, and so how can we get into their world? And they also have emotions, and they also have feelings, and so it's to be mindful. And we want to encourage people to continue to educate yourself, continue to be supportive, and I appreciate that we have so many people that are interested in learning about autism, because it's important. Whether you have a child that is autistic or not, you may know someone that has a child, have a relative that is autism. So I just want to say thank you. Okay. So someone just asked a question. Let me see. So the person said she got a diagnosis with me last year, and insurance will not cover it. She's wondering if there's anything being done to spread awareness to insurance companies so that they can start to address this matter. Well, one of the things that my company is starting to do is we're having business talks. So what that is, we're inviting companies and we're having presentations. Why? Because We also realize that there's not a lot of awareness about it. Um, and so, yes, that is in the pipeline for us to go to insurance companies. A lot of the insurance companies have been contacting me in terms of assessments, and so hopefully we could find a middle ground whereby they're able to cover the cost of assessments um, for these type of assessments. So I'll just wait for a couple more minutes to see if there's any more last questions so that I could answer. All right. Well, if there isn't any more questions, feel free to contact the office at 636-0823, or you can send us an email at info@counseling-site-bze.com. Okay, someone said they had another question. Okay, I am not seeing a question by Joe. Can you retype the question for me, please? I am not seeing it. Okay, so we're just waiting for one more question. Someone had posted the question, but I'm unable to see it right now. So I'm asking the person to type it again so I can answer that final question. Okay, someone asked if I'm doing assessment at this time. So I can do some assessment virtually at this point. So depending on what type of assessment, then I'll be able to determine if I'm able to do it virtually. So because we're on lockdown, I'm unable to do some of the tests, but there are some assessments that I can do. So the smaller assessments, but the comprehensive one, we could start the process in terms of doing the stuff that we can do virtually, and then hopefully by the time the end of the quarantine we could complete the rest. But for now, what we can do is, for example, we can do the clinical interview virtually, and there are forms that I will need to be completed by parents and teachers if the child is in the school system. Then I could send out those to the parents and teachers at this point. There are some things that, for example, I could coach parents in terms of creating that safe space so that I could do some observation. Those are some of the things that I can do at this point. Because of the pandemic, there are a lot of the tests that are currently in the process of being adapted to doing online assessment. So I am a part of an association that is giving those information as it's happening. So as soon as those are up and running, so for example, I know a couple of them that I can do virtually at this point. So again, it all depends in terms of what type of assessment you want to be done. So yes, the answer to that question is I am currently doing assessments, but only brief assessments at this point. Mm. Okay, Miss Christie, I'm not seeing the question that you added. Can you please? Okay, I'm just waiting for Miss Christie to type question for me. I apparently missed a question, but I'm not able to see it. So while we're waiting, if you have any more questions, please feel free to let me know. Okay, so that seems to be all the question. The last question was about insurance. And like I said, I do plan in terms of reaching out to insurance to explain the type of assessments that I offer and in terms of what are some of the benefits so that they could add it on. But I'm already in the process of engaging different businesses and explaining the services that I offer. And so once quarantine is lifted, we'll be able to figure things out from there. But thank you guys. Thank you for all the questions. I do appreciate the questions. So do have a good day. Remember to do something fun outside. It's a beautiful day outside. All right. Bye.